Dr. Guleria, women are joining the workforce, but these incidents will only force them to drop out of workforce. Shouldn't that be a matter of concern? And particularly, here is a doctor who has been raped inside the hospital. This was supposed to be a safe zone for her.
Yes, I totally agree with you that there is a huge issue as more and more women join the workforce and they become part of the medical profession or any other profession. There is a need for us to really develop a strategy so that they are protected as far as the working environment is concerned. Unfortunately, as we've seen in the medical profession, when we look at our residents, the number of residents has increased dramatically over the last few years, but the facilities for these residents has not increased. And there are many hospitals where there is only one duty room, both for men and women, and they have to stay and sleep in the same room, which is not acceptable. And I think that is something that even the Honorable Supreme Court has said is not acceptable. Similarly, the facilities are not up to the standard in terms of the requirements that are there from not only from the protection point of view, but from the infrastructure that is needed for anyone to be there who is on duty. And I think therefore there is a need for us to develop a strategy to be able to see that whatever the Honorable Supreme Court has said and the National Task Force that it is set up, whatever the recommendation be, they be implemented in proper spirit and they are actually implemented at the ground. Otherwise, this will be just something that we keep raising an issue about, but nothing happens at a ground level.
But in terms, since you have been a director at the All India Institute of Medical Sciences, my question is, how do you ensure that there are safe spaces or a resting room for women doctors, women staff?
So I think the most important thing is that you have to look at two things, the infrastructure and the security. As far as the infrastructure is concerned, as your resident number increases, as you start having more people, you need to also develop that infrastructure in terms of duty rooms, in terms of resting places, both for nurses, doctors, and for other healthcare workers. So that is as far as the infrastructure is concerned. And at the same time, you need to develop issues where you are able to have security, which is either in a way of security guards or limited access to areas where residents are working or where they are resting, so that patients or attendants or anyone from outside cannot access that area.